There's a camera right here, so I guess if you're wanting to point it to somebody else,
Okay. Sure, we can just yeah.
Is that for other people that are not going to be here to see you, or is that what?
It's to see the presentation.
Oh, okay.
And to join in the discussion and to listen, actually.
Okay.
So we should be up. Anybody listed yet? But we've got a good 10 minutes.
Yeah.
Okay.
Okay. So I'll be back.
Thank you.
Yeah.
You are awesome. Hey. Nice haircut. Well, so far so good. It looks like it's working, right? Hi, how are you? Good, how are you? Good. So far so good. And I can be easily persuaded. Oh yeah?
Without everyone talking, it's kind of do some settings and they had their questions and then the response and then the comment on the response. Yeah.
What program was it?
It's on my computer. Yeah. It was so cool.
It sounds cool.
You know, it was I've never heard of it. Yeah, it's like I call it like what is this? Only I can say that. Who are you? What are you doing? So she said, I think you'll
Hello.
really, really like it. Wow. Well, thank you. Everyone else is pretty yeah.
It's that, yeah.
It's that. There's always that. Thank you for the call.
Oh, you're welcome. Hello.
Hey, how are you? Good. How are you?
Hello, Linda.
Sorry, I'm always late. Thanks for staying on top of everything. You know, some of the investigators like, oh, you can call me, you know what I mean?
Uh-oh. Why did you stop?
I don't know how to do anything.
Lovely. Okay, we're back up.
I was talking with Nancy Tyler and Joel Shank, and they're interested in applying for, trying to write a grant. And they'd like to talk to you. I said, I thought, checking with you to make sure, you know, it complement not overlap.
That would be great.
Do you have any time next week?
Wednesday's free. I have a meeting until around 1 on Tuesday. Yes.
So your morning is off, so in the afternoon?
The afternoon on Tuesday, let me see. Yeah, Monday, I'm in a meeting until, I'm in a meeting until 2, and then I have another meeting at 3. So Monday's out, but Tuesday, that would be great. I'm sorry. Do you have a piece of paper? Hmm? Okay.
Just be reading, but you can't keep it because I have to read it.
Okay, that's okay. So, but I don't think everybody is there yet. Five people on.
I bet you have more than this.
No, I'm sure you do, but I should.
Yeah, you should then.
He's in the emergency room doing what? Oh my gosh.
Yeah.
Yes.
That's my thing. I figured out it's up that whole. Oh, this is not your end. This is your end.
So we're not hooked up to that. For some reason, we're hooked up to here. So to be honest, it would be better for me to unhook from there and to stay hooked here, but I want people to see the presentation. No. No. Mission's here. We're not done. I'm gonna try and take notes. I'm just not gonna be able to type. That would be great if you could help. I think that's okay. We haven't started. This is. That's adorable. Oh, great, Simon. That's cute. There was yeah. We're gonna get started. Everyone who is here, and I'm pleased to report that we are webinaring. We are having some kinks. I'm getting some emails. We're not using this camera right now. We're using the camera here. So I'm going to be facing my laptop towards the presenters. I have a feeling I'll be text if they can't hear you. So I'm Kelly Caseman. I'm the Director of Child Health for West Virginia School Affordable Healthcare, and this is the West Virginia Kids Health November 2017 partnership meeting. Thanks to everyone for coming. There is coffee and hot tea up front. We will have lunch coming. Thank you, Barbara Wessels and Unicare. Woo!
Lunch sounds a little fancy.
Yes, and then cupcakes in support of Jonah will be coming at around 12:45, and that's 2 dozen. So if Jamie Jeffrey were here, I would say eat in moderation. But there's going to be 2 dozen of them, and whatever you all don't eat, I'll be taking back to the office. So feel free to grab a cupcake if you would like. With that, I'd like to start with introductions. So Chantel, I'm Chantel Fields, the Executive Director of West Virginia for Affordable Healthcare.
Sam Hickman, Director of the West Virginia Chapter of the Association of Social Workers, and MSW intern, Alicia Watt. Okay.
Linda Watt, Acting Commissioner.
Our presenter, thank you so much for joining us.
Lauren Hopolo with Kanawha County School Nurse and Marshall University School-Based Health.
Good morning, I'm Jim Smallridge, I'm the manager of community development for Better Health.
It's a pretty good turnout. So thank you everyone for coming. We have a lot to talk about. So I'm going to go ahead and give the floor to Linda. And we are going to try and follow the slides as you're speaking, but there's a bit of a delay. And if anybody has problems who is webinaring in, please text me and we'll try to fix them as we go.
Good morning. Morning.
not big about being on a webinar, but we'll be okay. As long as I don't think about it, I'm just gonna go flying through this. I was asked to come and provide an overview of some of the issues we're facing in West Virginia in foster care, as some of the work that we're doing to try to address those issues. So this PowerPoint has some data, but it will give you just a really broad overview, not down to the details of how things are happening. I really do believe the issue that we have with the opioids, with children coming into foster care, with children at risk of coming into foster care, children that are in situations that we may or may not know, it is going to take a statewide collaborative effort to address it. It's not just one bureau or one department like DHHR who has multiple bureaus, but all of us trying to figure out ways to help others in those communities, either not be in those situations or getting into those situations or finding the resources to do that. We know budgets are tight, we know money is tight, but somewhere along the line we have a lot of great initiatives going on. We've got a lot of great work going on, and we don't always toot our horn about that and about the work that we're doing. So I don't want to take light of all of those things that's happening out there. So with that being said, our mission, we want to collaborate with stakeholders. We want to manage and provide appropriate health and human services for our residents to improve their health, well-being, and quality of life. And that's not just around children. That's our adults, that's our families, anyone that we come in contact with that needs those services and support. We've had an increase in substance abuse trends. Oh, did I miss the overview? I did, the overview. I'm sorry. Got ahead of myself. So back in 2015, the U.S. Department of Justice came into West Virginia, and across the state, they conducted interviews. They talked to a lot of providers, they talked to family members, they talked to some of the department workers, and what they decided around what we were doing is we have too many kids in congregate care. Family foster care is not considered congregate care. It's group residential, it's psychiatric residential care, it is children that are in that group setting. They also believe that we do not have a full continuum of services and supports, so that folks have accessibility and they're able to access their services when needed and in a timely manner. And that we didn't have this continuum across the state. Some of it is our geographic area, but when they were talking, it was some of this basic accessibility to mental health. And then our service delivery model basically wasn't showing that we had improved outcomes, that our practices weren't showing that kids and families were better off. So, and that we weren't incorporating some of the very values that we as a state said that we were going to do, and those are those system of care values.
All right, which one are we
So this is the next one.
Do you want to go past that one?
So we're going to talk a little bit about the increase in substances, the increase in basically kids coming into care. I want to talk a little bit about workforce insufficiency and the fact that we have no substantial increase in resources. We're stagnant. We've been that way for a while. Is it going?
Yes. Is that?
Yes, not good. Okay, so we're having just a little delay on the slide coming up. I'm showing it.
It is. I don't.
There it is. So let me start to talk about it, and then I wanted to show you those trends. We've had an increase in opioid deaths over the last couple of years. West Virginia is number one in drug deaths across the nation. With that, we've had an increase in children that have neonatal absence syndrome, drug-affected babies. With that being said, we've had an increase in children coming into foster care as well. So when you look at opioid deaths, you look at the red going up here over the years. When you look at foster care children coming into care, between the ages of 0 and 30, for years we saw a high number of children in care between 12 and 17. And all of a sudden, in the last couple of years, we're getting more and more young children. And specifically children between 0 and 5. You can see that's growing. NAS, look at the spot, the children, neonatal absence. Our revenue. Okay. So we're getting the referrals, we're getting, the need is there, but sometimes our resources are not. And so we're having to work within our resources and trying to figure out ways to deal with that. Our kids in placement. I did this 1 month ago for another committee meeting. In 1 month, if you look at this, this is about 6,100 kids. This was done for an October 12th meeting. As of October 31st, I had 6,314 kids in care. 100 and some additional kids. They're not all Children Protective Services. The Bureau serves children that through abuse neglect proceedings, but we also serve kids that come through juvenile proceedings. Status offenders, adjudication. So these numbers are going up, as you can see. Just trying to give you an idea of what we're facing. So some of the current trends, here's one. My increase in kinship relative care. You want to go back one? That one?
This,
Yeah.
no, that's
Well, let's go back. Let's go back and then I'll get to that.
I'm sorry.
Reduction of
You want number?
Okay. So what we're doing right now, we're looking at different strategies. We're looking at, we have a model, a 4E demonstration project that we were awarded in 2015. It's called Safe at Home. It is a nationally recognized wraparound model so that we can keep kids with their families and families can be safe. And the family doesn't have to be the biological. It could be a grandparent, be an aunt or uncle, child. Try to keep them in the community with the services and supports that they need so they are not disrupted. We've had an increase in relative kinship care, trying to get services to these families quicker and looking at getting them certified so they can get funding to help with them. We have a reduction in parental placements in psychiatric residential treatment over the years, and I'll talk more about that because we have managed care for families now, and they have a care coordination model. And they help families, they help try to get those kids where they need to be in treatment. We've had a reduction in out-of-state facilities. We've had our health check program. We saw some really increases of our kids getting health checked. And with the new added questionnaire in there about trauma, that's identifying our kids earlier on with trauma. And then we're working on some increase of community mental health services. So we'll go through some of this and I'll talk a little bit more about it. So our numbers basically enrolled in Safe at Home have grown. We are at over 1,200 referrals right now at Safe at Home, 1,296 kids. So keep in mind that as my numbers grow of children entering in our care, we are really keeping some kids in the community. We have 781 prevented cases. These are children that have not been taken out of home. So that's huge for us, that this model is working for a number of children who are at risk of removal but we are able to keep them in the home in this model that we have created through the funding and the support of the federal government. This resource ends in 2019. We are talking to our congressmen or senators now about the need to continue this, because this is one of those community-based resources that if we lose, could impact our children being removed and being in places that may not be as supportive of that family environment. We've had an increase in kinship relative placements. These are grandparents, aunts, uncles, family members who are taking children into their home that are relatives or that are known to them and now caring for them. They may be a little bit older. They may have some of their own issues, but we have actually tripled the number of kinship relatives that are taking on their children, their grandchildren, their nieces, their nephews. And one of the barriers that we have is, how do we get supports to them? We might close a case after a year, but that doesn't mean that that child's not going to have issues 2 years down the road, 3 years down the road, 4 years down the road. There is no evidence of what drugs does to a child if they're born affected. There's no evidence of what a child's behaviors would be like if they are in a home where they're met. There is very little research on that. So we are seeing more and more children with behaviors in school at age 5, age 6, and age 7. And I'm not sure we're prepared for this influx. So this is an area that we've got to really work on. We don't want these kids to come back into camp. We don't, but we've got to find ways to help grandparents, especially when they become legal guardians or they adopt these children. Okay? I talked about reduction in parental placements in psychiatric residential, and I really do because with managed care, they are able to help and give that care coordination to that family. Because in our traditional system, when a family placed a child in a psychiatric residential out of state, okay, that provider in state closed the services. And parents gave the system themselves and help that transition. And I think that is a huge piece of why these numbers have come down for parental placements in psychiatry.
Hold on just a sec.
I'll talk about this while she's putting it back up. We have reduced our out-of-state numbers over the years. They're going up a little bit. These are for children that we do not have the resources in state to serve them. Their behavior needs, their mental health needs are so intense and so complex that basically we do not have in state. So some of the kids are placed out of state for a period of time, and then they return back to the state. So we have done that, and I think we've done that effectively. We've seen a little bit spike going back, but we've done that well. And like I said, this is the out of state. There you go, as you can see. And this is unduplicated numbers each year, not a point in time. So sometimes we'll throw out a number of, oh, there's 189 out. That is a point in time number. This is actually how many children went out that year and came back. So some kids will go out for 3 months and come back. And the last one I have in a data to show you is our health check program. And we are really staying consistent in making sure that our kids get their health checked by age. And as you can see, the spike is 69. They're doing an additional health check, something around 7 now. So we're going to see some additional, I think, improvement there. But those trauma questions that they build into the health check is really going to help. Not only for our kids who come into care because they must have this for 72 hours, but for all kids that have the Medicaid card and are able to. So I want to talk a little bit about our general overall welfare reform. When I talk about welfare reform, It is a department-wide initiative. It's DHHR's initiative. It's not the Bureau for Children and Families or the Bureau for Behavioral Health or the Bureau for Public Health. It is our initiative across. But we can't do it alone. It's really when we look at it, partnering with everybody to really build this initiative and get this work done. So one, we want to look at increasing our foster care capacity. We still are short. We do not have enough foster families. And these are families who do not have a relative or relationship with these kids. They are out there providing a service for us in helping with our kids. Some of our kids are difficult at times, but you got to remember their trauma that they face coming out. It's all the unknowns. And so their behaviors may escalate in those initial first weeks because of that until they feel safe and secure and that they understand what's going on. So we don't always have that as kids in foster care homes. We're looking also at CPS workers statewide, recruitment and retention efforts. As you can see, my numbers growing up. That means it's more investigations, more open cases, more work that has to be done. And I have not had an increase in protective service workers in many, many years in the Bureau. I've not seen that. So we've got a lot more influx, but the job's not easy. The job's not easy. 10 years ago, we were facing the opioids or the needles that folks. So finding people that are so incapacitated that you have to call an ambulance and a police officer to the scene. And I have to say that we try our best to make sure our folks are safe. And sometimes in our geographic area, it's scary because the cell phone, there isn't a cell phone service still yet. To get an officer out and you can't get a phone call out can be very scary for staff. We've lost that because they felt they were not safe. So we're working on a lot of different things. There's no fix on this issue, but we're looking at recruitment, we're looking at retention, we're looking at safety, we're looking at ways to partner with our other folks across the state. And what we want to do is improve this piece, because I believe if we improve that piece, that we will help families better overall. Salaries is involved as part of that. Yes, it is. Not only recruitment and retention salaries, but we're looking at salaries as across the state. We are not competitive on some of the bordering states. We are losing staff for $10,000 more a year, bordering lines. We train them, we get them in, and then they go. And I can't blame them, but it's not just about that. It's about safety, it's about the environment, it's about flows. So we're looking at everything, not just funding, not just money, not just safety. We're looking at one of our other strategies is to expand treatment options for substance use disorder. We have substance use disorder waiver that has just been approved through Medicaid, and we're looking at, I think that is going to help our families across West Virginia who need that service. We are looking at expanding NAS services and centers across the state. That is working in one area. And we're looking at expanding the drug-free monitoring. These are only a few things. It does not encompass everything, but I want to show you the kinds of overarching objectives we're looking at as we're moving forward. We're implementing the health management strategies, welfare. We're looking at that managed care environment for kids in foster care. They're on a fee for service. So we're looking at, can we do managed care as well and have that care coordination piece? We think if we can put in a care coordination piece for kids in foster care, we think that's going to help out tremendously in helping our kids in that system. We want to increase community-based We want to get to kids not after crisis, but before crisis. We know there's a lot of things out there that's working, but there's some things that our sister agencies are working on. We have to expand and say, home. The Bureau for Behavior Health has actually piloted in several counties for children that do not enter child welfare in a legal custody issue, and they are seeing success. We know that there's success. It's another type of resource to try to keep a child and a family together in the community with the right resources and the right services. Fourth, we want to increase the number of families in consultation. That's your early piece, going in and visiting parents, visiting grandparents, giving them the information, the services, and what they need. School-based mental health is an initiative that Behavioral Health and Health Facilities has supported, and the department has supported, but it's not statewide. Where it's working well. In some counties, they're still in development, but it's not another access to mental health services that our kids and families may not have because of transportation, because of the time of day, because that sometimes our traditional hours do not coincide with the hours that the family use. So it's another aspect. We want to expand the juvenile diversion program. They're working. Right now, I can tell you that kids that are at risk of being removed, these diversion programs are working. They're getting some mental health treatment. They're getting coping skills. They're getting the services and support so they don't come into this. And then multiple crisis and stabilization. We have families who are at their wit's end, and they pick up the call and their child really needs, and they really need someone to come. Behavioral Health has started working on that. We want to look at that as well and how well that's working and where we can expand it. Increase the number of children appropriately screened. We are looking at that inventory of screening tools in West Virginia. We want to come up with a recommendation of maybe 2 to 3 that we say is the best tool. Not that you can't use others, but we don't need 25 tools. We need tools that include trauma, include those identification of needs. And then what can we do about that so that we can educate and make sure we're using some similar tools. We need to increase workforce across the board. We're looking at integrating an assessment tool that is nationally recognized. It's the CAMS, the Child Adolescent Strength Assessment, and the FAST, the Family Assessment Tool in the child welfare arena, CPS service cases. However, we really need to work together as we're moving forward on looking at our workforce and trying to build strategies to build our workforce across the board. We don't have a lot of clinicians who understand mental health and substance abuse treatment. We have things that are coming up, and our workforce, from what I can hear from providers, is very slim as well. You know, we're not getting the qualified individuals to do that, and we may need to invest in training and some support there. And just to summarize, we've got to build a continuum of services across the board. Some kids are going to need out-of-home short-term. Some kids will need just the preventive in-home intervention. And some need some things in the middle there. And somewhere along the line, if we're going to address these issues, we've got to look at that continuum as a whole and not a piece. We want to keep families and children together when they're safe and when at all possible. We want to provide early identification and treatment. We want to, as a department, reduce redundancy and duplication. That prohibits sometimes getting services and access. We do want to provide assessment tools and practices that are provided across the bureaus, that we as bureaus agree that these are the ones that are going to enforce the rules. We want to involve stakeholders We want to be transparent. We want to work with you. We were just talking about multiple committees and meetings. We can't be everywhere, but there's a way to partner. There's a way to talk. There's a way to come on. And we want to be accountable. We want to provide quality services from what we do and from what our families get from the community. Timely, quality, and we want to be out. And I think that's what everybody wants for our children. And that means, our constraints. Our constraints, budget. We do have a budget constraint. You know, I don't know how to fix that. That's not within my wand. But I do think we have some great programs and resources. And I think by talking through, there's things we can do within that scope that is going to meet some of those needs. I talked about workforce insufficiencies. Federal health care reform is going to impact West Virginia. If we get a cut reform in Medicaid, that means we're going to cut some services. It's just inevitable. I don't know what that impact is going to be, but it's going to impact our citizens in West Virginia, and we need to be able to talk about that and understand that. Reauthorization of CHIP. It's huge for us. If we do not get the money, there are a lot of children that are not going to have health insurance. And before we were able to expand CHIP, these are the kids that we saw coming through our door for us to provide some services to them, because there was no other mechanism to get that. So, yeah, that's huge. It's huge. So, then we got to remove the silos. We cannot work in the department. Our cabinet secretary is very committed that we are not bureaus within the department. We are a department. And we should be working across the bureaus to effectively have a continuum and where the gaps are, then we work on those. That's why child welfare reform is not a bureau initiative. It is a department initiative because it is going to take public health, behavior health, child welfare, children and families. It's going to take Medicaid. It's going to take all of us working together to figure out how we can integrate some of the work that we're doing and complement this continuous movement. So that ends my presentation. I thank you very much for allowing me to be here, and I will take questions. Not guarantee that I can answer about it, but I will take questions. Yes.
I got a million things.
I figured, Sam.
Boil it down to two. One is vision of corrections has sort of fallen into a strategy to help them get more pay for a correctional officer. That looks like their discussion in the department about working with government officers, collaborating with others to try to develop the same kind of strategy for services. You could take every word that's been written about the crisis of correctional officers and change that to CPS.
I have not seen the strategy. I cannot tell you if the secretary has not been involved in looking at that. So I would like to take that back as an opportunity.
I think it's something to follow into.
Right.
And the other question is, we ran into Secretary Spears with DMAPs on Wednesday outside the Capitol, and Thursday outcomes. I don't know about this property. There's some serious discussion. I don't know if people know. Speaking over the years about breaking up the HR sounds pretty serious. That's, and people are with that, but you get from saying that it's not something that's hard, it's something that's law.
That has been brought up, that there has been, and there may be again, last year there was legislation to take Medicaid out of the department. I think a couple years before that, there was discussion about the department being too large and that they may need to split. Those discussions are occurring now that I'm aware of. I have not had those discussions with folks. I will say to you that this is Linda personally. This is not speaking for my cabinet secretary. I have found working with our sister bureaus has been very beneficial in addressing the needs of our kids. Bureau for Public Health does a lot of, they do some in-home, they do birth to 3. Our children that come from my bureau, which is abuse and neglect, I can get them in there and get those needs met pretty quickly. And we've been working on like the health check tool. We were very part of that. Bureau for Behavior Health. We have regular meetings about how do you develop that continuum. So some of the block funding that we get comes through their bureau. And they're able to do things that as a whole, as a department, we may not have been able to do if we were split. So that continuity and that work together is crucial to where we're at right now with child welfare review. I'm not sure by splitting, and I don't know what the discussions are. I just know that for me as an acting commissioner, I work very closely with the other bureaus. I work with Medicaid, I work with child support, I work with behavioral health, I work with public health. If I did not have that opportunity and be able to do that fluently, we may not be as far along as we are right now. And that's how I feel. So we will watch that. I'm sure the cabinet secretary is watching that. I enjoy working with my folks. It's a little harder working with folks when they're not with it. And I don't know what our funding structure would look like if that happened. That could be devastating, you know, by how those pots of money are funneled. So. Yeah.
Linda, you talked about my mind is down with like, how does it affect something that is on the part, that sounds rather than done all of it, but reality for that on the project,
Thank you.
you know, but that like I couldn't see the
We had almost a 50% reduction.
I think that those numbers need to be shared for a while. Help us help you.
I don't think anyone anticipated the impact of the whole situation for you. I think we were working on things. I know, but I'm just saying, and it was out there, but I don't think anyone really was able. If they did project it, it was not to the what we're seeing now. So.
I don't know if you want to do video or online. Or even that process. They don't know what all
I like the video. We work with Mission West Virginia quite a bit to help do some of the PSAs and the outreach. They've done some very county-specific recruitment, boots on the ground, sending letters. But this video is a great strategy, and I don't think we thought about that, but I think it's a great strategy. Yeah. And one of the things is, we have homes that close. It's not that we can't find them. We had over 800 adoptions last year, and these homes closed. So, you know, when you lose that kind of number, and this might have been multiple kids in that adoption, when you lose those numbers, we're not replenishing as fast as the number of kids that have. So you're right, but thank you for it. If you think of any other strategies, let me know. We're really trying to figure out ways to build that awareness and get this done. Oh, I got all kinds of hands up back there. Okay. Okay.
Thank you. Linda, in following up, what is that over? Part of that,
And I'm glad you're bringing that up because I'm probably not aware of that. We have quarterly meetings with our foster care agencies. Well, about 4 years ago, maybe 5, it was decided to contract out foster to adopt, the process of home finding and some of the recruitment efforts, of course recruitment, but getting families to the point of when they were interested to the final and in a timely manner. And of course, there's some requirements there. You do a home study, there's some evaluation, you do a background check, you engage in a foster family training, so that all of those kinds of things that are built into the certification process. What the department did was we decided to certify kinship relative. We kept that. That was a piece that we did. Some relatives do not want the subsidy that you can get with foster care. Some would go and apply for TANF benefits and get that TANF check instead. So they had that choice, a relative did. And then we did keep some of our traditional homes that we had already had and we've had established for years. So in essence, the department has kinship relative and some homes that are traditional foster care. Everything else went to the agencies. We have, I think, 11 maybe, right now 11 or 12 agencies across the state. I got involved with them back last year and we started quarterly meetings. We increased some language in their agreements around recruitment and around that process. We address these barriers just about every time we meet. I asked the other day about the process and the timeliness. Of course, I did not get the answer that the statement that you gave. However, what I did say to them was, I want to talk to foster families across the state. I'd like to have 2 public meetings with them, not to give them questions, but for them to tell me what's working, what isn't working, as well as kinship relative placements. I can't address issues unless they come to my attention. And once they come to my attention, it becomes an issue that we need to address. I always like to hear the good things too, but normally I hear all the bad things. So I'm looking at trying to do that public forum and trying to get some folks out to talk about that. But certainly, anytime there's an issue like that, please let me know. Now, I mentioned turnover. A lot of these agencies are facing the same thing. If someone can get a better job for 5,000 more on the year, they're taking it. I can't. I don't have any way. It could be. It could be. It could be getting lost. Yes. Mhm. Mhm. Well, now hold on. Not necessarily, because foster families have the right to choose the age, the sex, the gender. And so we may have an abundance of homes for children under 3, but that may not be my population I need. Okay? So like right now, I'm struggling with children that sleep in the office sometimes, at least once a month, that are 12 to 17. Okay? However, um, I'm not sure our foster families are approached in a way to say, do you understand when the department takes a child, their immediate need is a roof over their head, a bed to sleep in, and some food, and then we'll work on matching them maybe to the home. And I'm not sure our families understand that sometimes we just need that 48-hour bed. You know what I'm saying? And they're not. So we're looking at a different approach because when the family says I only want a child between 0 and 3, they're automatically eliminated. But if we approach it in a different way, saying, will you take this child for about 48 hours or these sibling group of kids because we just removed, they may change their mind. You know what I'm saying? And I think sometimes our approaches and what we have done in the past is not working now. So we're going to have to find new strategies. But I really would like for you to see me at the end. I really would like to talk to you about the agency and what's going on there. Okay. Okay. Okay.
I just had a question, kind of to follow up on this. I have two friends that are with different agencies. I have one friend whose process has been fairly quick. I have one friend who is at the process of the agency side. It has to go to someone else for them to be signed off, and then a third person to be HR. They've been doing it for 10 months now, going on 11. And they've been more than ready. They finished their classes several months ago, waiting for the home part of it, and then now they're just waiting for the paperwork to get signed. What is supposed to be like the length of process? Is there a general? What is?
Are you talking about with an agency? Or are you talking about with the department?
Well, is it the agency themselves that determine the length of process? Like
Any home that the agency that we have contracted with the agency, they do not come back to the department for an approval. Okay. If it is a relative or a kinship, we define kinship as someone who has a relationship with that child and family. It could be a coach, it could be a teacher, they don't have to be a blood relative. Now we do treat them at our end as a kinship, and that is through the department. We do that. and they do have to go through the full certification. And that does get signed off by a program manager at the department, okay? So the only thing that the department signs off on is when it has to do with us, a relative or a kinship, okay? That would be the only time it's signed off. So the two differences, I would need to probably figure out if this one is ours, if it's a kinship relative, if there's a delay, what's that delay? And we have mechanisms to follow up on these issues. I don't think folks understand that. So not that I want 100 calls a month, but in order to break down the barriers, I got to know it's a barrier. And if I don't know it's a barrier, I can't break the barrier. All right, well, you spread the word. I will take the calls. Yeah. Well, we will. We're going to try to get them scheduled. I'm hoping to do them by the end of the year, but we're already at the end of November, so it may be January, February. But it is going to be done. I really need to hear from folks. And I think that's the only way we're going to be able to do it. Yeah. Yes. We do on our side have the checklist. We have also developed a letter for kinship relative placements and give them numbers to call if there is any bottleneck, anything going on. I don't know about, I'm sure, no, let me put it this way, I'm not sure about the age. If the only one is, they can apply to be foster care, yes. Kinship, yes. But kinship cannot apply for TANF because you have to be a blood relative for TANF. So you have to be an aunt or uncle. So kinship, we put through the certification process so they can get the foster. But we will address issues. We've been trying to do that as we move forward. But I can't address them if I don't know. And I'm not afraid to ask the questions. Laura Barno is my point person right now. She's the director of Children and Adult Services. In our customer service line, we also have a line where you can ask questions and get responses back. So we have that number, but we'll try to figure out how to get that number out there. Actually, one state has what they call, and I don't know if I want to do this, but I may just do this. They call it the commissioner line. And if you have a concern or a question, you call that line. Not that I answer it myself, but at least this way, things that have been brought to attention start getting addressed. It may be funneled out or whatever, but I'm checking in on how the states are handling that and the volume that they're getting to be able to do that, because I would need customer service to help get those answers. We're looking at how to better serve. Yeah. So many of our kids who come through the department automatically, and I talk about trauma in a way that many of our children are resilient to trauma. However, when you remove a child from a home, you remove them no matter what people think, no matter how unsafe it is. or no matter if the parent is unable at that time to keep the child safe, it is trauma. When you take a child out, whether it's a baby, a 5-year-old, a 10-year-old, a 12-year-old, you take them out of that home, you are leaving behind their personal belongings most of the time. You can go back and get a few things, but it's not still the same. It's not their bed. It's not their pillow. And when you place them, the first thing is I want to remind folks, it's a traumatic event. So we place them in a home, place them in a shelter. Sometimes for short term, sometimes a little longer. And we determine and assess what their mental health condition is or their needs. Some of our kids don't have a lot of mental health needs. They may have a few medical needs. Some of our older kids may have some additional mental health needs, like some of our kids may be ADD. They may be ADHD. They may have bipolar disorder. They may have anxiety disorder. This is something that's come through. So I can't give you any direct, but when our children have those mental health conditions encompassed with some of that trauma, we've got to address it as a whole. Some of our kids, our older kids, have tried substances. Some of them have used substances. So it's a combination, and we look for the treatment place that's going to meet their treatment needs. So they are there not long and overdrawn, but they get in that, and then they come back to the community services. We have an increase of children coming into care with intellectual and developmental disabilities, compounded with mental health and some trauma-related issues. And your traditional mental health modalities are not working. They're kind of a behavior and a combination. Some kids coming into the autism spectrum, and the autism, children in autism are like very focused. So when you disrupt their whole life, you disrupt a lot of that focused structure that they've come from. So by removing them because they're in unsafe situations, it's causing us to have some additional behaviors and complex issues that happen. So it's a variety. There's no one disorder or no one issue. Yeah. They go into, some kids will go into our regular foster care system. Some will go into a group residential, depending on the complexity of their needs and behaviors and the severity. Some we are serving through safe at home in the community. Okay, because they don't hit the threshold that they're eligible for, like a Title 19 waiver program. They're between, their behaviors are intense, and they're able to do certain things, but they're in that, I call it the gray area. They can. We have not had an increase in those beds because those specialized family care is 0 to 99. We've not seen a lot of children beds develop through that program. And we get some kids with medical conditions, feeding tubes, different medical conditions. And our providers have been good if they can find a home. Thank you again.
Oh, now I have a couple questions, and then some
I was
folks,
trying to get you up here.
and then some folks, we'll have some
Okay.
on online. So let me just kind of flip through here. There's no hiding. So one of the questions that I have, and feel free to be frank, you're with Frontier. So I find one of the biggest challenges I have in just talking advocacy for this demographic of kids that we've been calling transient. So we're not just talking foster kids, but we're talking kids who are being through child welfare and juvenile justice, that are they may be sitting on couches for a while, so they may be off your radar. And that their lives, it's very hard to explain to folks, sometimes because they don't want to hear just how hard, some of the terrible things that they're going through. So, you know, we've been talking, one of the first lines of defense is that we think we should work on before we start talking kind of policy issues to try and get these siloed bureaucracies working together within communities is, you know, to help with the CPS problem. But one of the problems I find is that CPS workers often feel very hesitant to share what their experiences are like. So what do you think we can do to help get the stories out of what these folks experience?
I think it varies. And we have counties that have more referrals, more drug issues than others. We have counties that have lack of resources. The counties that I think work well, and I'm only saying this because I think you can understand this, there are counties that do extremely well. They have enough staff, they keep staff, they're experienced staff. But they also have relationships. They have relationships if they have a primary care group. They have relationships with their probation officer, with their judge, or the judicial, with the providers in that community, with workforce. I mean, it's about bringing together school, and trying to work together. I'm not sure that's always across the state, Kelly. Is that we stay so busy with our work, so the counties that are struggling and having more crisis of the day tend to do less of the relationship building and working together. Your expanded school mental health folks. I mean, some of my staff that are struggling probably don't know about certain programs out there. Brand new staff coming out. There's not this resource. There's a wonderful app, but I'm going to tell you, when you have 30 kids you go to see every month, because that's one of our policies, they're worried about seeing their children and doing case management, not so much worried about trying to find an app and start doing the work. So word of mouth is good, and when you start to build those relationships, then things become easy. So I don't know. I understand what you're saying. How do we get this to come forward? We can put some things together for workers to talk about their experiences. I'm sure we can ask them. I would just be respectful about understanding the dynamics of their county and the severity of the problem in their county. Because one county may be doing, we've got counties that do really well, and others are exploding. Right. And they've had a lot of turnover and the stress level. So as long as that, I think we can work together.
Do you have any counties where there's a co-location of a CPS worker in the school?
I don't think we've asked for the CPS worker in the school at all. Not since I've been on board. So I don't.
Family support worker, there's this,
Family support. Yeah, family support, meaning you've got probably benefits, I would say, on the family assistance side and a staff benefits. Family support, I'm not sure if we have a CPS worker.
right, family support. I guess maybe it's because of Title I.
I think Kelly has one more there.
Yeah, so if if there's anything that we could do to help you, like a policy issue, and I know that you can't just say, here, go do this, but if there's something that you think, you know, from a community advocacy level could happen to help make those connections during legislative session, what do you think would be a good first step?
We have to retain CPS. That is on our forefront. And to retain them means we're going to get to families, we're going to do better case management. We're going to be able to keep it. So that if I had my choice, we need to get folks to understand this is a statewide issue. It is actually a national issue. I came back 2 weeks ago from talking to 16 other states, and we are not the only ones. We have about a 23% turnover. And keep in mind, we fill positions, but they leave usually within the first year. Alabama had a 40% turnover. You know, we have states out there that are in the same identical situation as we are, and they are struggling as well. And we are looking at strategies and trying to improve the way we do things. And we have sister agencies that are in the same boat. So yes, my CPS issue would be a primary.
So is that
Well, I should
needing
say
help
the
with
department,
funding?
huh?
So is that needing help funding or for CPS?
I think funding, I think the number of workers we have is going to have to increase.
Just get your positions stable.
Yeah, if we could just get them stable and filled, we would be in a lot better shape. But if these numbers continue to grow, it's gonna cause probably some additional staffing.
I also think it would help if we, Tim and I have talked about this, like there needs to be better PR for CPS workers because they're seen as the state, the one who takes your kids, and they're not seen as the ones who are here to help. So we've got to figure out a way to, I don't mean rebrand, but a way to kind of get the word out as to actually what they do. And we've been doing more work with providers. And sometimes providers, when they're kind of stuck in their clinic or they don't work more with the communities, have a tendency to put blame on the CPS workers because they don't realize that the CPS workers' hands are tied, that there's limited resources. You know, there are only so many kids you can pluck out because you've got no place to take them. So I think that getting those stories out would be helpful.
I don't disagree. I think you're right. And I think educating folks that when we go in and we do have to remove, it's really because of the safety. These kids are not safe in that environment. Not that they cannot go back, but at the time that they're removed, there is a safety issue. And that child's safety is foremost. And it goes both ways because sometimes we'll go out and we'll do everything we're supposed to do, but the safety doesn't run to the level of removal. And we have folks who believe we should have went in and took them out of there. And on the flip side of it, sometimes they don't understand, and we do remove because it came to that level of safety. And it's not, we train staff on assessment, we have a process, we have questions. It is not Linda's idea that mine is different. We have a framework. We have a practice model. So you're right. We do need to educate folks more on it and try to get the word out. And people tend to remember children the way they were. So we've had children removed. Maybe they did have a lot of trouble at school. Maybe they did some things they shouldn't have done. And they went to treatment, they received treatment, and people cringed to come back to the community. But that person, that child's not the same. That is not the same as what they were before. So there's a lot of education there. We have a lot of work to do. We can't do that alone, you're right. We need to do it as a group, as professionals, trying to explain things if we can. Yes. I know how many homes I have. We have been working on, and this was not something that was done in the past, so we just had that conversation this past week to see if we can get what I call a bed availability. A little bit harder because these are fluent numbers. So we started to work. Now we do that with group residential and psychiatric residential placements as well as shelter, that we get a census every week of what's available. With foster care, we don't. And we're trying to figure out a way to do it. Yeah. So, I mean, I know I keep moving around because I can't stand still.
That's okay. I'm looking to see if they have any questions.
But you're right. I mean, these are strategies we're looking at and seeing if we can actually get that. And then understand if there are vacancies, what's the ages? Because if I have a gap for 10-year-olds, 10 to 12-year-olds, then that's where my recruitment efforts have to go. It can't be for children under 3. We're trying to get that from the agencies. Yes, we are. We're trying to gather some data. We cannot work forward trying to recruit for specific age groups until I understand what we have. Yes. Yes. We're working on this. I do not know the actual number right now. I don't have the actual number right now. I don't have it. I didn't bring that with me. I could try to get it to you. Fully staffed on 424. And to tell you how many I truly have, we have packets in right now that are being processed to be hired. And then, of course, I have then the true vacancies that have not been posted yet. We've shortened our training. We had it for 3 months. We've shortened it to 2. We didn't take anything out of it, but we put more experiential in there. So workers were getting more of the courtroom, interviewing, family, things that were important to do the job. And we piloted that twice. So we are working really hard to change things, to try different strategies, to really try to figure out how to get workers boots on the ground quicker. And keep in mind that even if it's a brand new worker, we give them graduated caseloads. They will not get a full caseload when they come out of training. It is very graduated so they can learn as they go.
Okay, are we ready for comments
Yes.
online? Okay, so someone asked if the PowerPoint was available. Yes, I will send that after the meeting. Somebody mentioned Craig Klein mentioned a mentoring program as an excellent idea with CPS workers in the Eastern Panhandle. There's one going on, so I will find out more about that. I will share that by email. Do you know anything about that?
I don't know anything about that, but we as a department, on part of our CPS strategies, we are working on a mentoring program for new CPS workers, as well as a mentoring program for supervisors in training, because this job can be very traumatic. There are things that we experience, even as myself experience every single day, that we take home. So we need to have that outlet. staff now already that we use to help them, especially with the child fatality that they've been involved in. So we are really looking at ways to help them to be able to cope in this field and in this job.
Okay, great. So we'll share some information about that. From Jim McKay, he said, yes, we need more foster homes, but as ACYF Commissioner recently commented, we just can't focus on the supply problem of too few foster families, but also a demand problem. So we need more efforts like home visitation and those strategies that Commissioner Watt mentioned. So
I agree.
okay, she agrees with you.
We got to get to them earlier. We've got to get to those parents. There are grandparents and relatives who are taking care of kids that are not in any of our systems. We don't see them.
Right.
And they have taken on a huge task. We got to figure out ways to get services to them.
Right.
We really, really do.
We're going to talk about that in December.
Okay.
So feel free to come back.
Okay. So, I mean, yes, I think it's just the whole continuum. And how do we do this together? I mean, if there's things that are people doing, how do we do this together? This is my motto. I want to turn the faucet off and get to kids earlier on. Okay? That's an ultimate goal that I would love to see us take on, is turn off the crisis and get to these kids earlier. And I know there's programs that are doing this.
I just want to say, 424 workers in the field staff, 2016. This is what it's not like. First is down to 38,704 calls. That is not the 8,706 calls from the 2-1 hotline, which is strictly for law enforcement. So think about all the this year is 2017, very much very but if I know that it's raised my tax, it's raised my tax. If I know
And there's these calls come in now. I just want to clarify. Some of them are duplications. Yeah, some are duplications. But, you know, there's a percentage that we have that we accept. We accept, there's a percentage. So we need to, you're right, we probably need to share that even more. And we are looking at, Deputy Secretary Jeremiah Samples has been looking at some data elements so that we can share that more, to really show folks what's going on. I'm not sure we've done that very well in the past. We've done it in meetings and things like that, but not really publicly. So we are looking at that. He's very committed to that. Yeah. Between 10 and 12, I can get you the actual number. I don't think it's more than 12.
Okay, so Doris is having a hard time hearing the questions. So when Nisha is up, I will repeat them for you, Doris, so you can make sure to hear those. And then Jeremy is with us from the Eastern Panhandle, and he said that Craig had to leave for another meeting, but he said that he believes a CPS mentoring program would be great in the Eastern Panhandle, and he'd be willing to work on it. And he's the BSW program director at Shepherd University. So we're going to look into that.
And give me his name. We've got a committee working on that internally, but we would love to share our ideas. So please.
I think it would be very beneficial if you all did some training for school principals, school counselors, to let them know how the CPS process works. Because I know as a school nurse, you panic and you don't want to send a kid home, and you do everything you can to try to get a CPS worker there. Knowing what the caseload is, knowing how hard it is to get one there, but
you've got a principal screaming they're not gonna go, you know, I can't let them go home, but I can't keep them there. Yeah.
Oh.
Yeah, they do see a lot. That would be good if we can get folks in there where we can bring Rebecca and them in to do that training. I'm encouraging, and I mean, if you have an avenue, there's community service managers in every office. There's some that do 3 or 4 counties in smaller counties, but one of the things we've been talking to them about is to build those relationships with the principals so that they have an avenue to call someone. Because sometimes workers are in the field and you can't get that worker immediately like right now. So I think if those relationships, if we get those built, I think it would be really, really helpful. Yes. I think it's a combination. I don't think there's any one program. I really do believe it's a continuum. And for some, it would be home visitation. Others, it might be expanding the mental health services in the school system to get to kids earlier on before they get to the point that they haven't received those services. I think we need to look at what we have and how do we improve it? And is there a way to improve it and expand it? So I think we have some great things going on in West Virginia. I just think we need to take and look how to improve it. And with that being said, they're helping the school to understand these children have some behaviors and that your traditional classroom modality may not be the best thing, that you may have to work outside of that normal box. And that's where I think things are getting more, there are successes because we're not in this traditional, the way we did it 20 years ago is the same way we got to do it now. We've got to really start thinking about creative, innovative ways to helping our kids be successful without removing them from the situation. Yeah.
Three to one.
Mhm. Just to family resources. Once again, thank you. I will stick around if you need me or if you want. My contact information is on there. Please feel free to call. Thank you.
Yes, yes. Okay, so we are going to break and eat lunch for about 20-25 minutes, and I'm going to plug in my laptop. So folks, please stay connected to the webinar, or you can click back in. I'm not going to close my laptop, so it will close. If you have any questions, please type it into the chat box, and we will address them after lunch. Thanks. Family?
That's his family up at Illinois.
Yeah.
That's up from last one. Were you still on the text?
Yeah, yeah, yeah. So that was Kat.
Oh, okay.
Yeah, she probably. Any of them are vegetarian.
Sit on my hand. We were just gonna have, cupcakes.
I didn't either.
Yeah. you did. Yeah. Well, media is never going to get your speakers anywhere. Some visuals and somebody
Working a little bit better than it did the last time I tried it, but. So I've been connecting to the earring, which they treated, it's like a laptop. And when you connect to it, you can't connect at the same time to the internet. So we came early and connected it so I could connect to the internet online. So for some reason it kept. So they kept, it was good news for us when the PowerPoint was up here, but for them because then it would freeze it. So. Okay. They could hear, but she became very. It didn't dawn on me when he and I have talked this before that I should sit and see how long, whether or not it would take me.
national webinar. Well, they're on these calculations.
Oh my goodness. Yeah, that's a bigger problem. Oh. It was really good.
Well, that's a 10:30. That's a 10:30. Hey, I have a federal.
So what do you want to do? We got something to do, so we want to ask about conference, maybe? It was an opportunity. I won't be here. Yeah, I think it's a.
I know. Your area. Yeah.
Well, he's, that's not what he's doing. He's saying somebody's going to take your services from you.
If you can go, the only time the song is yeah.
He's going away, but there will be so that's what they're going to do. Secretaries one of the things to do with services. He was saying, I'm not sure you want to take your services. It'd be interesting. That's why I didn't. No, but there are people who think, well, this is the thing, which is everything. This is
If there's ripple waves that happen.
well, this is separate, and that's where they're coming together, so. Force behind all this, and they're almost trying to get attention. That's it.
This is a different type of meeting. Come on, we can handle it.
Sounds good to me.
Just different sources.
How are you?
Yeah, there you go.
Good, thank you, sir. Yeah.
All right,
See ya.
what's the schedule for?
Hey, hold on, I have a question to ask. I meant to ask you on.
Oh, I just.
I meant to have a little thing on half all of our families that we had there.
Yeah, and I was, I think I wasn't here. But no, I know why. Right. Oh, yeah.
That far along.
Do it. The last rain game. I got 7.5 bucks. You know what? The seats aren't as good as but they're dry. They're dry. So absolutely do that.
Yeah, so my son.
I understand. Yeah, I don't know. When you get that, when those things come down the pipe, you gotta have it. That's what I do. Oh, that's right. I was thinking about that, yeah. See, when I was up there, I worked. While I was in school, I was managing the basketball team, so I was always up there on the holidays for things. I never got home for Thanksgiving. The whole there. I got home once or twice. Yeah, that was a good thing, man. Get out and do it. Mhm. Oh, yeah. And I got
Origins, you know, they say, there's talk about.
Yeah.
Yeah. What's the place at?
I don't know, I don't think it's a good idea. things.
Like some of them. But I still say.
But it's much more serious if the secretary is bringing it up on the sidewalk.
I just emailed her. Okay. Well, actually, I emailed her last week. I didn't know if I had it wrong. Okay. Now, and you know, and I emailed her last night.
Which I did. Oh, I have. I do have if you don't care to share that. Yeah. He is one of the ones that, right, that's like, thank you, Tracy White. Thank you. I can, well, I'm reading now. Okay. All right, thank you.
I think the day before I had a meeting with them.
All around there.
Yeah, I use my teeth for things I want.
Well, I don't know. I work in a hospital, so we get to spring roll, hot dogs, and you name it all the time. Wherever it gets on us, people just walk down there. I'm like, don't bring the blah. You're not taking anymore. You got done yourself. Well, I know.
I did order them.
That is a box you want. Absolutely.
Chocolate.
Oh, that's excellent. That's everything within moderation.
That's why it's like, oh, I was listening to things that I That's probably what I need to do.
Tracy Wade and high school. Let's keep moving. We've got an hour left. They are very. Yeah, thank you, Barbara. I know.
Sugar free, right?
Yeah, oh, yes, there is no fat. Okay. Well, thank you. Hmm? Oh, I am. Yeah, I'll just give this to Tracy. Let's see. Let's see if I can do this. He has the most wicked laugh. Nisha. NECIA. Hmm.
Oh my gosh, what did I do? What did I eat? Oh no.
After you answer Mother Nature's booty call, you fill the air synthetic citrus. Hope the scent of last night's burrito won't follow you back.
They're gonna know my secret. And they're gonna hate me. Come on.
Well, A, that's not just active, right? Summer kitchen. I don't know if you get more than that.
I agree.
I think it has to be a little bit.
You can do it. You can do it. Brittany's coming. All right, I'm gonna try this one more time. It looks like it was about to play. All right, this is how I'm gonna introduce Nisha.
whole.
My computer stopped working with it. Okay, so this was the trailer for Heroin, and one of the ladies featured in the documentary that's on Netflix today. She runs the ministry, and she serves both kids and prostitutes. I've seen the documentary, but I actually wanted her to come and talk to us because I saw her talk at a Better Value work group meeting a few months ago at the Bureau. And she was so frank and honest and fearless in what she shared with everybody. I thought, well, she's got to come talk to us. We do. We like that. And I'm hoping that we can talk a little bit about ways that we can discuss potential policy issues to ensure that kids don't wind up prostitutes. That they don't, I'm going to assume that some of these girls wind up at younger ages because they either get kicked out or they have a substance use disorder of their own. So if you could just come up and speak your truth to us, and then we'll talk about what we can collectively do. That would be bad.
The ministry is called Backpack and Brown Bag. It was started in 2010. In 2010, we went to the inner city of Huntington, where you're from that area. There was a radio station that was the public nuisance, and it was required to be torn down. We were right before they tore it down. And my old Bible teacher, this would define my personality from high school, and I'm 54 now, so I haven't changed much. He always called me a rebel with a cause. I have a cause for being spunky. I don't think it was a cause. And he contacted me and asked me if I would be part of a 1 mile radius around the Sunoco station. At that point in time, 2010, it was a hot spot. And in that 1 mile radius is an elementary school. It just so happens it is the elementary school that my daughter teaches at. So we went to the principal and just said, what do you need from Christian community? What can you do to help? And she had children that weren't eating on the weekends, and we said, not a problem, we'll take care of that. Now, since then, I think a lot of national backpack programs have started, but we are not part of the national because even this past week, we have a child that, for the last one, was in the car. So a package of dry oats is going to serve no purpose if we have no water. So we're very picky about what we put in the bags for what we call the hardcore dinner and lunch items. Everything is pre-cooked and everything is pre-tab. That way, kindergarten child can fix their own food if they have to. We are now up to, as of today, somebody's delivering my share for me today, so I'll be here. We have approximately 74 children that we have followed from kindergarten all the way up to high school. We provide them dinner for Friday, breakfast, lunch, dinner, Saturday, Sunday, one drink and some snacks. My church is an amazing church. It's a World Baptist church that who sponsors this ministry. And our church members kind of adopted the kids. And we have members that have adopted a child for $30 a month. That pays for their main food items. We count on public donations for breakfast, snacks, and drinks. We like Pop-Tarts for breakfast because you get 2 in a pack. They're better than a breakfast bar that you get in one. So we really tried to think through all of this on what best serves the children. We always have, negatively like the guy that wants to do army rations. That won't be a problem. We provide accept donation. So we'll have $15 in the corner. We'll accept your donations. Not a problem. Since then, I don't know if you've seen the documentary or not, but in 2011, there was an article in the paper, and it was just about 3 lines, but it said that a woman had been found in a cornfield about 40 minutes from Huntington. She was a known prostitute. She'd been shot. She was dead. It is always been my personality to I love backstories, like how did you get here? And nothing was ever a follow-up. She was a prostitute and basically and come to find out about a week later, because I kept waiting for the end of the story or the beginning of the story, she was actually one of the parents of our backpack kids, and who was being raised by a parent, or by a grandparent. So at that point in time, I think shallow. I don't think really I'm a surface thinker. I don't go in deep because it takes time. So I just thought I would take some brownback lunches to some prostitutes. And we put a gospel tract in it. They would be like the first 5 people in heaven if you've ever read that book. They would sit on the step. They would get the tract out. They'd read the tract while they're eating food. They'd accept Jesus and life. It didn't happen. Jokes on me. I am living proof of this. So since then, basically what we've done with the prostitution ministry is we are about detox, rehab, and Jesus. In Huntington, there's 8 detox beds. As of today, I think we're working on some things, but as of today, there's 8 detox beds. Now, the problem is when everybody says we'll just go to rehab. On the prostitution end, or women, because I get called for women, recovery point for men is awesome, and recovery point for women, awesome. But how long did it take us to get the 100 beds for the men to 100 beds for the women? We have babies and we have periods. That's what I was told by officials, is that we have babies and we have periods. So they don't really want to focus on us because it's men. So that one as well. I only know of one rehab, and it is in Lexington, Kentucky, that will take a woman that is not detoxed first. So that is the problem with rehab. We can find some rehab beds, but we only have 8 detox beds. So we're number 1 that everything is bad. We have hundreds and hundreds and hundreds of overdoses of people that want to go to rehab, but we only have 8 beds to get them the first step to go. I'm a fan of Narcan. I think it's awesome. I think at this point, until we come up with some detox bed, what we're doing is giving you life, but we're not giving you life. We're bringing you back, and we're going to bring you back again, which is, I'm all about that. But we have got to go a step beyond that give you the option to have your life. I think what got me in trouble and why I'm here is because I made one little, somebody said, your front lines, what do you see that needs to be done? I fight for them verbally, I fight for them financially, I fight for them in my spare time, and I'll fight for them in my real job. I'm a realtor. If I see something, I'm calling somebody. And if I have to call you twice, I'll call you twice. So out of that 38,784 calls, I think about 38,000 of them was me calling about 2 specific children. It did take us 2 years to get them out of home, but that one we did. I don't remember anybody's title, which is good, because
because if I'm not here to offend anyone. I am front lines. So I am not about statistics and numbers. I'm about and how we can come together and fix this problem. Sometimes it's with our jobs, and sometimes it's outside of our jobs, and sometimes it's both. My have two family members that are in the school system. Actually, I have three of them to talk about. My oldest daughter is in the school system, and this is the message, and I'll try to say this about her, because anytime we talk about my kids, they're awesome. This is the pictures that she sent me this morning of a student. And here's the remarks that goes with it. We have seen no one since September the 27th. I did get a letter with a person assigned to the case, but that's it. Mommy said God did it, and the little boy said it happened to myself. Last school year, I left multiple messages with a caseworker for the same child about several concerns. No return messages or phone calls from them until the child showed up with his arm in a sling, his parents saying it was broken because another child pushed him down. I sent another message relaying to the same social worker with the additional comments of, do I need to contact your supervisor to request another caseworker? And I got a return call within minutes saying they would schedule a home visit, and nothing came of that either. As a teacher, never heard back from them. We don't need details, but it would be nice to hear if they are actually visited and listened to our concerns. We are left out of the loop all the time. I know it's for confidential purposes, but we are expected to care for these children and watch for potential threats or signs. But it would be nice to know if this child is having issues at home before an imminent danger arises. From another school teacher, and this was this morning when I was sitting back there, I was texting to two people that are teachers, and this is their exact words, and I didn't have time to text more. This is from another one. The man that just drowned in the river after killing a man, he had called on him. They had called on him for hurting and bruising and leaving marks on the kids. The CPS said that the house was clean, so they left the house. The son said about the man that was in the river, it's okay, he was dead. Somebody else was called multiple times several years ago, and they did nothing. The dad was charged 3 or 4 years ago and made the paper, and that was 5 years from the phone call. For 4 years, they've been trying to call CPS over this child, and nothing ever happened. And so the man has passed away, and children are leaving. It's terrible. The recent Vega case that you have seen in the news, they called CPS over that, and they called 5 years ago, but he was just not the case. So I am a huge proponent of, and as I said earlier, raise my tax dollars. I don't care. I want to stay in Washington. I'm a realtor. And I showed a house about 3 weeks ago to a doctor that is going to his residence. And he said he saw the documentary, and he said, now what can I do to help? And I said, what is your plans when you graduate and become a doctor? And he said, well, I think I'm going to head to the Carolinas. I said, then you're part of the problem. So you've got to stay and help us. So some of these things that we need is we've got to have people want to stay. We have to have people want to say, okay, $10,000 to go out of state for another job. What is the cost of living? What is the taxes you're going to pay on it? What is your property taxes? Because Ohio doesn't have cheaper taxes than all. They just don't pay car taxes. Taxes are weigh it all out. So at some point in time, we have to put a value to what that $10,000. And at some point, I say $10,000 is really like $5,000. Well, what do I want to do? My daughter, when she was asked to be a school teacher, she's been in the system about 12 years. She was having the opportunity to give for the spring wanted middle classes you can get. It is like, that's cool. And my daughter said, I'm making a choice to go where I'm needed instead of where I'm expected. And that's what we need. That is my youngest daughter, 19. It's her first semester at Marshall. And she's going to college to be a CPS. And I'm here with these stats that she's going to college and there's nothing on her itinerary that prepares her for what she wants to do, other than she's been part of the backpack industry since 2010, and she's been part of, thank goodness I said when she finally turned 19, it was like, oh, we're passing the message, I can't come and get you, because you're my child. She's seen firsthand how these children are raised, and she has seen firsthand why some of the brown bag girls are where they are. One of our brown bag girls, and as we all know in the news yesterday and today, the mother got off for letting the man rape her 11-year-old daughter, have an abortion. And part of this is the law. It's no one here. I'm the most non-political person you'll ever meet in your life. I don't care if you're Democrat, Republican, if you're one, you don't believe in abortion, and if you're the other, you don't not believe in abortion. It has nothing to do with who we are here today. There's a law out there somewhere that needs changed, that 11-year-old child, when it was abused, that does not have to sit in front of her abuser. And because she chose not to have that trauma put onto her, and the ones that love her chose not to let her have that trauma, that he gets probation. And that's the bottom line. He got probation because she did not want to set for him. That is what we have to fight for. That's what we have to fight for here. That's what we have to fight for when we're setting it on the wall. That's wrong. There's nothing right about it. So I don't know who to vote for and who not to vote for, but we are living in a George Jetson world, and we're abiding by Fred Flintstone laws. So, we was watching George Jetson. We thought, well, that's pretty silver. Now, you can have a road rocky. We're living in the Jetsons era. One of our girls is 36 years old, and we give each girl a fake name so I can talk about them and we don't know who they are. This girl's fake name is Cornerstone, and she's now about 35, 36 years old. When she was 10 years old, 5 years ago, she testified against her dad. 25 years ago, you do not testify against your dad for rape. That is unheard of that happened. When she was 8, she turned him in for raping her to her mother, and her mother did judicially and motherly what was correct. Took 2 years to go to court, and she went to court and testified against him, and he spent 1.5 years in prison for raping his daughter. When he got out of the prison about 5 years later, he cut off the ear of the neighbor's dog. He served 5 years in prison. And as I'm sitting at Western Regional, a small cubicle, talking to her with tears in her eyes and a broken voice, but more importantly, a broken heart, a void heart. It wasn't even broken. It's just, there's a difference in a broken heart and a void heart. And when you see these women, sometimes what you see is just nothing. You're looking at nothing. And she said, can you explain to me why the judge sent my dad to prison to cutting off the ear of the dog longer than he did for rape? Now, she's 35 years old. She's still on the street. You can imagine. I mean, I never want to say that there's no hope, but when we aren't saving the children at this age, and when they grow up, this is what we're dealing with. And I think one of the drug issues that we're having today, and I'm all about it, all in it, need to be, and over on Netflix, is that we are so focused on the 25 to 42-year-old age group, because I think the average overdose is 33 to 36. We're forgetting second graders are going to be adults someday. I am all about. You would be pretty hard pressed to convince me differently that each school does not need a CPS worker in the school system. You would be hard pressed to convince me that social worker does not need to be in each school. My awesome brother-in-law is the superintendent of Wayne County Schools, and I called and asked him how many open CPS cases he had in his school and how many are considered homeless. Now, homeless in the school system is a little bit different. It means that you're not with an immediate family member. You might be with your next door neighbor staying in their apartment, but that's considered homeless because you don't have a defined address. School system never knows what that is. And this year he has 127 open CPS cases with approximately 137 in foster care that are monitored by CPS. That's for Wayne County Schools. Now, I called another school district and asked them, how many CPS kids do you have? We don't know. How many homeless kids do you have? We don't know. So if a child misses school for 2 days, you're assuming that they have a cold. They're not, and they're living in families that which we could raise them. Yes. So I can barely use my iPhone without my 19-year-old saying, I told you to swipe left or right or use your fingers or whatever. But I'm not an IT person. But there is a program out there, or someone, a man or a woman, that is able to make a program that a principal of the school should know how many children they have at CPS and how many children they have homeless. So when that child is missing from school, there's a flag put up that says, we need to see what's going on with this child. Now, one of the cool things that Spring Hill Elementary does, and their principal, which is amazing, she makes all the teachers, including mine and my heart always goes, oh, the school's getting ready to start. It is a requirement that each one of her teachers go to the home of their student before school starts so they can see firsthand what they're dealing with. It's very eye-opening. They're able to switch their schedules to not have English when you first come in. And if Johnny puts his head on the desk for 20 minutes when he first gets there, that's because he's been up all night listening to gunshots. And listening to screaming and yelling. He hasn't been able to sleep. When they're stuffing food in their pockets at lunchtime, they realize it's because they're not getting anything. So by the teacher is your CPS worker. I don't know how to say it, how to define it, but the teachers are staying with these children for at least 8 hours a day. That's if the parent's not home, the bus driver brings them back. That's if my child doesn't bring home one of her students because no one ever showed up. My daughter brought home one of the kids multiple times last year and we left in pieces, so it wasn't a problem, but still, that's what the teachers do. And if we want to, one of the problems that we have in this state is low CPS workers and low teachers. And one reason why is because they're overwhelmed with their job. It's not about ABCs and 1, 2, 3s anymore. That is not what it's even hardly close to. Our neonatal babies, we are #1 in the United States for having babies that are born addicted. Another thing we're #1 at. Well, these baby addictions that started years ago are now in our school system. And we are not prepared for what it takes. On a side note, my youngest daughter, was in 10th grade when she was diagnosed with dyslexia. She doesn't do the was and the fall. She's English comprehension. She doesn't catch on to the word. She sounds it out, skips over it, reads that same paragraph about 3 times, and has the comprehension problem of not being able to focus when she doesn't know what the word is. We did not know this in 10th grade. I'm a single mom, but her and her dad, or my ex-husband and I, both worked very hard on putting our children first. And we had a tutor for her from kindergarten all the way to 7th grade. Because her reading grades got better. We thought we even did it in the summer. We did it during the school. She was tutored at school. She was tutored at home, and she was tutored in the summer. And no one knows that my kid has dyslexia, because I thought going dyslexia was a problem. So then she gets to this standardized testing, which is the biggest joke you've ever heard in my life. And she finally, scored her grade average for reading. So we dropped the school drops her tutoring, and now we're only tutoring her privately once a week. When she gets to 10th grade, she takes one of those stupid tests again that we're spending way too much money on, that 4.5. And she calls me from school and she's hysterical. I mean, can't get it together, hysterical. And I'm like, what's the matter? What's the matter? And I can hear her, she's in a, it sounded like a bathroom. She's echoing a bit. And I said, what on earth is going on? At this point, she had not had the MU help, had not got the results back from the MU help dyslexia test, learning different tests. But I had already researched enough to know this is what she's got. So she got the test back, and it said that she needed to be, she would be best as a nail tech or working in a garden, like plants. And at that point in time, she said, Mom, all I've ever to do is be a CPS worker. You're telling me all I'm able to be is someone who does nails. That's why these tests go together. I couldn't get it back together. I had to call the counselor for the first time, introduce myself, say, my kid's in the bathroom, you go find her. Long story short, MU help sends the test back. We go into the test for the testing results. And the lady at MU Help I'm sitting there with my yellow highlighter, my full color pen, my paper just like this, and all my stuff lined up perfectly. And she looks at me and she said, you know this is hereditary. And I was like, no kidding. I mean, once we knew what she needed to do to focus, you got to have note cards, purple pens. Purple pens are the answer to people with dyslexia. Their mind retains the color purple. They need note cards instead of taking. Diary of a Wimpy Kid. Diary of a Wimpy Kid is the #1 book for kids because it's not on white paper, it's not your standard font, and it's not your standard size book. It is easier for the eye to only follow a column this big than it is for your eye to follow this. So that's why Diary of a Wimpy Kid is a great book to start teaching your kids to read. So she sits there and she tells me, well, your daughter's not going to be able to be some things. And these moments is when my ex-husband is like, he doesn't say much, but you can tell he's like, you said that to her, didn't you? And so he kind of likes to enjoy sitting back and just let me pick her. And I said, oh, really? Like, what can she not grow up to be? He said, she goes, well, I'm an engineer. I looked over at my daughter and said, do you have any desire to be an engineer? And she said, none. I said, okay, problem solved. So we're not going to be she doesn't want to be an engineer, but if she did want to be one, she could be one. She's just going to have to learn differently, but she could be one. So when it was all said and done, and she was telling me all the problems that my daughter was going to have, who graduated with a 3.87 and graduated 80th in her class. I said, you know there's a dyslexic font? And she said, no, there's not. I was waiting. And so I pulled up my phone and I said, but there is. There's a font for dyslexia. And she said, well, I didn't know that. And I said, and that's sad. You are over the MU Help. You are here to help children, and you don't even know that there's a dyslexia font. So therefore, probably the school system doesn't know it. So all we have to do to keep some of these dropouts, my brown bag girls, we have passed out over 325. We have passed out to over 325 different women. We keep a database of 4 because sometimes it's the girl with the ponytail that stands on this. I'm not making fun. That's just how we have to sometimes identify the girls. And so we've passed out thousands upon thousands of facts. I've not met one girl, I know it's true, that's not true. 2 of the girls that we have intimate relationships with, which was probably about 50 that were seeing weekly, that we've been to jail, that we're best friends with, that they got married at my house, that, they're in my top 10 best friends list. They all dropped out in 10th grade, so that means they had 9th grade education. And I would say out of the 40, 50 that we have a relationship with, I bet you 35 of them are dyslexic and they can't read. So we have to solve some of these problems within the school system that we have. Why, if we have a system, and MU Help has the ability to why are we not in our school system, like on second grade, kind of running every kid as a test to see what kind of problems that they have? If in second grade you can't put a snowman together, you have a learning difference from someone else. If in second grade you're not able to read Sally, Dick, and Jane, there's a reason why, and we need to have a learning difference for it. The CPS workers that are called, they're called multiple times, and, you know, 38,000 calls, so I've divided that. That's about 90 cases, a little over 90, between 90 and 95 cases per CPS worker for the state of West Virginia. That's insane. That's absolutely insane. And if we're going to change that, what better way to make it safe by putting it into your school system? Wayne County Schools volunteered for the state. Should anybody want to take them on this? They would put a CPS, they would be willing to be a pilot school to put a CPS worker and a social worker in their school, and they'll even give you a room to do it in. That way, we have one CPS worker that is taking care of 20 kids at that school. So your teacher's not calling 15 times because you're going to be part of that every day. In my opinion, that's not rocket science. We've got to take our people to the problem and quit making, if you want to tick me off, give me, thank goodness you didn't have one, I was going to say this. You have on that big jumbo paper thing, jumbo marker, and let's write what we need to do. And then the next time you have a meeting, you're flipping that page back and you're starting a new page. Boom.
Not that we've never been in that.
No, well, I've been in quite a few. In the last one I was at, they said, do you want your opinion? And I said, I'm out. I said, I'll go back to page 12, go back to page 6, 1, I don't know, there's something in there that and that's what we have to do. We don't have the funds, but do we really not have the funds, or are we spending the funds wrong? I mean, I don't think that it's lack of funds. It's not lack of concern or lack of care. It's that we're putting money in something that's not working. I don't think we need to blow up CPS, but I think we need to reform it. And if we're taking care of them when they're here, more than likely, it's going to be better for the kids. As for foster care, through the Brownback Ministry, we have seen a couple adoptions that should have been taken out of home. I am not for every parent, just because you're a sperm and egg donor, not making you a parent. And I believe that you should have chances of probably more than one. But at some point in time, my house and your house doesn't pass for foster care on a daily basis, then how on earth are we keeping these children in this home? You know, when we know what they're living with, and it takes you a year and you're down to delaying adopting a foster child because you didn't have the ladder to put out the second floor window in case there's a fire, and it holds up the process 6 months, that's insane. That is insane. I've lived in a 2-story house since 1986. And I got a ladder about 6 months ago when I was going to maybe be the babysitter for some foster kids that my friend had a foster care system because they were going to have to come and check my house too. I mean, we have an escape plan. You jump on my roof and jump down and my yard rolls and now you will get hurt. But when we're down to those kind of issues, and I think that's what we need to do on the state level, is look at our checks and balances and would we pass? Would we pass any of this? One of the people that was able to adopt a baby from the Brownback Ministry, she moved in with her July 2010. She moved in with them July 2015, and the final adoption was January 2017. One time they scheduled a hearing and had to be canceled because they couldn't find which jail the mother was in. And we're able to go online and find what jail in about 3 seconds. But they had to hold up the meeting, which then went another 6 weeks because they couldn't find which actually she was in prison. Lakin. She was at Lakin and they couldn't find her at Lakin. The forms that they make you fill out are terribly intrusive when you know that the birth parents don't have to fill out any forms. And because they have hearings all the time and don't do anything at the hearings, they couldn't find the mom in jail. And then they would forget to bring her down from there. So this is why it took a year and a half to think about this. They had given her absolutely every opportunity to get out of jail before they would even consider terminating her rights. And this has nothing to do with her case because they didn't care. But they had this 1.5-year-old and a 11-year-old that they took at the moment. The police come, she was a probation violation. The 2 kids are standing right there. They call me, hey, can you come get the 2 kids? She has a relationship with the girl with something with brown back. That we kind of switch off because man, it's like a 35-year-old that's breastfeeding a 30-year-old. And so we switch off whoever gets the next trauma girl. And so this trauma girl was her. So we showed up and the CPS worker let her and her husband take these 2 children. We called it temporary or emergency housing or whatever. And it wasn't an issue for them, but it would be an issue for many. It was 5 months before she received any support from the food stamp program or whatever it is, all these initials, but I get everybody, had somebody at the state level tell me about that stamp. I was really mad, and I said, you've got till 9 o'clock in the morning, I'll give you till 9 and 5 to call me, and I'm calling the news and newspaper, and she called like 8. And I said, food stamps, and she said, man, I must correct you, and I said, the day is not the way. To tell me that SNAP is the word I need to use. And so they never did receive it, but it wasn't an issue for them. But there's many homes that want to open up their, their family and houses to foster care that cannot take on this additional funding until it's established. Another case that I've had that just lasted in the first hand is that we had 2 children that were ages 1 and 3. They lived behind one of my brown bag girls, who is like a top 2 and is working at a pretzel store and living in this apartment. And she knew these 2 children were behind her, and the mom was in prison, and the dad was a drug runner. He actually put the 2 kids in the stroller, and everybody thought he was dad of the year. He was going over to Martin Terrace, familiar with Huntington News, Martin Terrace. And he was actually running the drugs through the stroller with the 2 kids in it. And so she knew they weren't being fed. She knew that they weren't being taken care of hygiene-wise. And so she was getting them baths and providing them food. So in lieu of that, we were paying her water bill and supplying her with food so she could monitor the health and welfare of these 2 children. One of the children goes to the hospital and has a, I don't know the term, but MRSA-like infection. And the dad did not stay there. She was in the hospital for 7 days. The dad did not stay in the hospital any, so they had to put this sweet little girl into one of the cages because the nurses can't stay with them all the time. CPS was notified, never came to the hospital. So the girl ends up getting out and going back to the custody of the dad. And about 5 days later, the son's in the hospital with the same infection, but the dad's smart enough to take them to another hospital. And so we're called kind of incognito. The child is here. Now what do we do? So it was in the emergency room because the dad called Hope and said, the kid's at the hospital, I need a pack of cigarettes. And you might want to go down there and stay. We go pick him up, we take him, and take her down there. And we're sitting there, me and my kid. And the social worker comes in from hospital, and 2 police are there because they're walking by, and one of them knows me, and they're like, and so I explained the situation, and they said that it was not a CPS worthy cause to call. So we were trying to figure out how to get the CPS worker to know that we were at the hospital. So after about 4 hours in the hospital, Hope decides, she goes, you know what? I'm the one down here. So, and if he would have known I was there, he would have been upset and very dangerous. He'd already threatened to slit the throat of the lady and watch her daughter watch and rape me, but he wasn't going to kill my daughter because it would be better served if she had that memory in her head all her life. So we really didn't want him to go out there. And what she decided to do, she said, well, well, the social worker at the hospital said, no, because we can arrest you for abandonment. We had to get a taxi and put Hope and the child in the cab to get her home after the child had said that daddy stuck me in the butt. And the place on his bottom reflected that there was some kind of a break. So I'm mad and I'm calling the state level and said, do you all have, and I already knew his birthday, the social security number on the back of his food stamp card. And I said, do you all not have the ability to type in this number and see that he gets $735 for food stamp card? And she said, well, I'm not allowed to deny. I said, I'm not here to deny, just give me information. I can hear you clicking in the computer. I know you got the answer. I'm just trying to help the system out. And so after her bantering back and forth a couple times, well, let's just say, for instance, someone does have that. I said, awesome, everything will be great. And I said, if he gets the food stamps on the 3rd, on the 4th, if you type in the same number and all the food stamps are gone, then do you not have a notification that all the food has been, money has been taken off the card in less than a 24-hour period? And she said, no, we don't have that kind of system. Insane that we don't have something that flags the stuff coming up. And I said, well, if you have an open CPS case for these two people for a year and a half, then and if the CPS worker would go in the day after and open up the refrigerator and open up the cabinets and see that there's no food, that is fraud of the government. There's not any taxpayer that wouldn't say, put his butt in jail, keep him there, and let's get these two children out of his house. But they said, told me, well, last week we did go check, and the house was clean, having any needle marks on the wall, because they were aware, and the CPS worker had also told him that if he smoked pot instead of drugs, they couldn't do anything to him for just smoking pot. And I said, but did you take off the socks? And she said, well, why would you take off the socks? I said, because these two kids are about $2,000 a month value to him, plus he's able to register at college, and he's getting his check to go to college, which he'll show up for 6 classes and gets to keep all the money. And I said, so he's shooting up in the socks so you for his feet so you can see. We are dealing with so many levels of this that we have no idea. The lady that stated that, how on earth did we get here? And we were like, we don't know. I think that is a problem that we have as citizens and we have as government. Is we know. And sometimes we're just like, it's too much more for me to fight. I can only fight so much. I can only do what I can do. There's no sense in doing anything because nobody listens to anybody. If we know what we're fighting, I can get you all a posse that you all would not believe. I can, if the statistics that you showed in the slides, if we have that publicly, you get that act together on foster care and what we need, and I can fill a church full of people that will come. They will come and they will support financially if they can't support a child. They will come and they will adopt. They will come and they will be temporary, but we don't know what you need. The only thing we see is the problem, and the only thing we hear is the bad stuff. We don't hear any good. I heard good here today, or great here today, but we don't know that. So we become, why bother? Why bother? And as a citizen, if you're a basketball coach, go to the woods and find a kid that's playing in the front yard, that's playing with a flat basketball, and go pick him up and say, you want to be on my team? I'm coming and picking you up every time. I'll bring you home. You better count on running through McDonald's too, because they're going to be coming. And sometimes that's the difference that we make. It might not be that we can get them out of that home, but they know that there's a rescue. And most of these children don't know who the rescue person is, and they think it's their teacher, and then their teacher's hands are tied. So if we can get these things into the school system, we're fighting half the battle. If we can save that second grader from it, we can save the 11-year-old from the dad that's raped them and impregnated them and caused them to have an abortion. If we can catch that early and we give them the help that they need and the mental that they need and the support that they need, then we are more able to mold them into an adult that is making a difference.
I'm sure we got questions. Hold on. Thank you so much. Anyone have questions? Okay.
As far as I know, there's absolutely no way to identify what are in foster care, CPS. I can't even see a nurse. I'm a
Yes.
nurse. I cannot even see.
So you're a first responder.
Right.
You are technically the first responder.
I cannot even read their IEP. I can see that they have an IEP, but I have no idea what their diagnosis is, what their accommodations are. I can do nothing to help advocate in that way. So I certainly have no idea. Nobody does, as far as I know.
And I think that some people have said we, get the principals here. And I know it would take time, but I think if you took a county, and I'm all about Wayne County, I live in Cabell County, so my brother's all about Wayne County, so I'm all about Wayne County, because Cabell County made the wrong decision for the doctors. I shouldn't think my brother-in-law. But I think that if somebody went to Wayne County, because they're eager to be a part of this, and somebody from the state, whoever's WVKHP, goes and says, "Where's your WVKHP?" Everybody's gonna say, "Well, I don't know." Well, how do you get into WVKHP? I don't know, because WVKHP is one of the things that the teachers have mentioned to me when they knew that I was coming here. The WVKHP program is not accessible. It's not easy. It's time consuming. It doesn't work. You don't know who it's going to. You don't get a response. So you call CPS. You're part of the 38,000 instead of the program that was developed for it.
Okay, so there is some more going on. There is and our practices, they're in discussions of the agreements, sometimes we take confidentiality to the point where you're not breaching that confidentiality, because I don't want to see the permission of education. There's about 29 people that when you agree to keep your file.
Yes.
29 plus people to see it. So there is some confidentiality, but they have been working on interfaces, either in our system, on certain screens and certain information. It's not there yet, but one of the reasons that they've been working on this is there are statistics out there that kids in West Virginia, grades are lower than children who go, even though they may go to that school or whatever, their grades are lower. They are not getting, their standard scores are lower. And what they found in a preliminary report 2.5 years ago was our kids missed those standard testing mistakes. They wind up not there. So
That's because they spent the last 6 weeks studying for a test.
Yeah, so
that is not educating our children.
And so our kids aren't getting put into that dip. So part of this is to try to